How does a DRE relate to PSA test results for prostate health? Understanding the connection between a digital rectal exam and a prostate-specific antigen test is essential for prostate health. Both tests serve as important tools in assessing prostate conditions, including cancer. The digital rectal exam involves a healthcare provider feeling the prostate through the rectal wall. This helps detect any lumps or hard areas that may indicate abnormalities. On the other hand, the prostate-specific antigen test measures the level of a protein produced by prostate cells in the blood. These two tests complement each other in the screening process. Elevated PSA levels can suggest the presence of prostate cancer, but they can also rise due to benign conditions like prostatitis or benign prostatic hyperplasia. Therefore, PSA alone cannot confirm a diagnosis. This is where the DRE becomes valuable. It can identify abnormalities that might not yet cause an increase in PSA levels or support concerns when PSA levels are borderline or elevated. Research shows that when both tests indicate potential issues, the likelihood of detecting prostate cancer through biopsy increases significantly. For instance, if the DRE is abnormal and the PSA level is above a certain threshold, such as 3.0 nanograms per milliliter, the chances of finding clinically significant prostate cancer rise. This includes more aggressive tumors, which are indicated by higher Gleason scores. However, it is important to note that the accuracy of the DRE alone is moderate, with an overall accuracy of about 60 to 65%. Its effectiveness varies based on the tumor's location within the prostate. DRE is particularly good at detecting tumors in the peripheral zone, which is closer to the rectal wall, but it cannot assess the entire prostate. In modern practice, PSA testing is often viewed as more sensitive for early detection. Advanced imaging techniques, like multiparametric magnetic resonance imaging, are increasingly used to guide diagnosis. Some guidelines suggest that with these imaging options, the routine use of DRE may be less critical. However, it still provides useful clinical information, especially when combined with PSA results. In summary, the PSA test measures a blood protein that tends to rise with prostate cancer but is not specific to cancer. The DRE physically assesses the prostate for abnormalities but has limitations in sensitivity. Together, these tests improve the likelihood of detecting prostate cancer compared to using either test alone. An abnormal DRE alongside elevated PSA levels raises suspicion for prostate cancer and often leads to further investigation, such as a biopsy. This combined approach helps balance the strengths and limitations of each test, enhancing early detection and management of prostate cancer. It is crucial to consult healthcare professionals for personalized evaluation and interpretation of these results, as individual experiences may vary.